I'm Prasad Nagajothi. I'm one of the hematologist medical oncologists at Mercy Medical Center. I'm a member of the hematology oncology staff here, and I'm involved in the care of cancer patients and patients with blood disorders. I also participate in the various committees, the Cancer Committee, Transfusion Committee, and participate in various tumor boards to help take care of the patients here. Treatment of cancer has evolved a lot in the last several years, and it is very unique. The management of each cancer is different, and management of each cancer patient is different. And various specialties have to come together in taking care of a cancer patient. So we have a medical oncologist where we mainly give chemotherapy, and we act as a quarterback in helping various specialties coordinate the cancer patient. Then we have the radiation oncologist who gives radiation. Then you have the surgeons, the lung doctors, the gastroenterologists. So since it is so complex, we all get together and we talk about the cancer patient, and we formulate a plan that is best for that particular cancer, for that particular patient and stage. And so that kind of gives a more patient-oriented and a more focused treatment plan, as opposed to a generic plan which is a thing of the past. So this way we are able to achieve better outcomes and overall help in the treatment of cancer. And that's one of the reasons why we were able to get 4 awards in a row, which is something which is very, very difficult to do. So any patient, when they are newly diagnosed, they go through a cancer care navigator who kind of acts as their quarterback and coordinates the care between various specialties. They make sure that the patients get seen in a timely manner. They are able to go through those testings in a timely manner, and they help them deal the stress of the cancer diagnosis. And they coordinate the care with the physicians and the patients. And the physicians are very approachable, very communicative. Like if I have a question about a patient, I just pick up the phone and talk to the physician, and the same thing, my colleagues do that too. So our focus is doing the right thing for the patient on a timely manner, and that's what we have been able to achieve through our work here, and that's what reflects in the Outstanding Achievement Award, where it is a recognition of all that we do for the patient here. The lung cancer is the commonest cause of the cancer mortality in both men and women, and it's a very complex diagnosis with several different factors playing into the treatment and the staging. The treatment has evolved significantly as well in the past several years, with several new agents being approved for use in the treatment, several new surgical techniques that has been approved as well. So in the lung cancer, similar to several of other cancers, we take a very patient-oriented approach, where when the patients are being diagnosed, we have a lung cancer navigator, someone who specifically deals just for lung cancer, who takes care of the lung cancer patients. And she coordinates the care with various specialties and ensures that the patient has a biopsy in a timely manner. We have some benchmarks where we take pride in the fact that we look at the fact that from the time that someone has an abnormal scan, be it a chest X-ray or a CAT scan, we would like to have a biopsy that is sooner than the national benchmark, to ensure that we have a timely diagnosis. And then from the time that someone has a diagnosis to the time that they see a surgeon or a medical oncologist, we try to beat the local and the national benchmark to ensure that the patient gets treatment in a timely manner. We present the patient in tumor board and come up with a plan that is tailored to that particular patient. And we also perform various testing to look for mutations to help in formulating a precision-guided treatment approach for that particular patient. And the improvement in surgical techniques also enables us to do surgery using a robotic approach with smaller incisions, better healing times. So overall, it is a multidisciplinary approach where we are able to offer the best possible treatment for the lung cancer patient, which is on par with the best cancer centers in the country. One Call referral is a very unique program that we have put forward at Mercy, which is unique both for the patients and physicians, the referring physicians, and it takes the stress out of referring. So with One Call line, all that a referring physician or a patient has to do is, if they think that someone could have cancer or even a symptom that can be cancer, they don't have to have a diagnosis of cancer. If they have a symptom or if there is any concerns that they could have cancer, all they have to do is just call that number. There is going to be nurses answering the phones, and they are trained in expedited care. So once the call comes in, depends on which system is. For example, if we think that someone has lung cancer, it'll go along the lung cancer pathway. If someone they think could have colon cancer, it goes along colon cancer pathway, and it'll go to the appropriate specialist. So that way, it takes the stress out of primary care, where they have to do too many things, and that they don't have to worry about which referral am I going to, which person am I going to refer to, are they going to be seen in a timely manner. So with One Care referral, we are very committed to ensuring the quality, making sure that the patient is being taken care of in a timely manner, and it's much less stressful for the patient also, where if the patient thinks that there is a concern that they may have cancer, or even if they want a second opinion or something like that, they don't necessarily have to wait on referral from other physicians. They can just pick up the phone, call the number, and then we can take care of them. Yeah, for the patients, the thing is, they can feel confident that they are getting, care in a center that is recognized for the quality of care. So they know that, this is something that has been, this program has been vetted, it has been recognized for the quality of care. So the patients can feel happy that they are able to get the best possible care very close to home, which makes, the whole experience of dealing with cancer, I think, much less stressful without having to travel back and forth. And for the physicians, it is a recognition of all the hard work that we do. Someone says that, hey, you're doing a good job, and they're giving an award. That just makes us go that extra mile, make sure that we get the 5th one in a row. What impressed me most here is a patient-oriented approach, where we don't just say we're going to treat the patient's cancer, we want to treat the patient as a whole. So here we do everything that is possible to make the treatment experience as less stressful as possible. We recognize that, in addition to the toxicities from the treatment, there is financial toxicity to the patient too. So Mercy is pretty helpful in terms of trying to help patients with that. They don't, change the quality of care based on the insurance. Patient, whether they're insured or not, it doesn't matter to us. It's the patient. So we kind of try to find ways to help the patient fight the cancer and take the stress away from them as much as possible. So the patient-directed approach is something that really impressed me, where let's take care of the patient and worry about the cost later. This is for my patients. These 4 awards are for you.